Hello again, Dr. Paul Bacon, Advanced Spine Health and Wellness, Portsmouth, New Hampshire, theposturedoc.com. Today we're going to talk about pinched nerves, and I think probably the best way to do that is to do it with my dry spine, so excuse me for a second for being so crass as to get out of the screen here for a moment. Pinched nerve is in our society common. We all know it exists worldwide. There's no one in any environment, I believe, today who doesn't understand what a pinched nerve is. For example, we had a situation the other day. A person presented for care and said, geez, I haven't been in for a long time because I didn't have any pain. When I did a range of motion assessment, he had a lot of restriction in mobility, but he didn't have any pain. In our society, that's what we measure by. If I don't have any pain, I'm fine. I think if you check the obituaries every week, you're going to find that many people on that list were feeling fine last week. So they obviously were not functioning very well, but they didn't have any pain. And when you have cancer, you, for example, have many years while these processes are developing where there's absolutely no sense of pain whatsoever. And so if you have high cholesterol and your blood pressure is off the charts, you may not have any pain or even sensation at all, and you're seriously afflicted. So we need to get out of that vein of thinking about I don't have any pain, I don't have any problem, especially when people I meet on the street from time to time and they say, what do you do? And I say, well, I'm a doctor of chiropractic. And the person will be standing like this and moving like this and say, geez, you know, I've had really good luck in my life. I've never had the need to have chiropractic services. What is being missed in this situation? Do you think that this is a product of ideal function? I think that it's not rocket science to know that all these muscles and ligaments and joints are paying heavy dues for that postural attitude under gravity over a period of time. And so this you're not going to get away with at all. Human body is not that quite forgiving. And so then what we have is when we see that the nerve roots come out between the vertebra, the hole where the nerve root comes out from is formed. The top half of that hole is made up of one vertebra. The bottom half of that hole is made up from another vertebra. So that when we have changes in position of these vertebrae, then we have the propensity to go in there and irritate these nerves. For many years, actually, it's more a traction on the nerve and also a rubbing on the nerve. When you go in and do clinical assessments on these things, you can go ahead and put digital pressure on these nerves in a patient that has no pain or symptoms, maybe some restriction of mobility or even low back pain. And these nerves are, you go in and touch them and the patient is off the seat and peeling them off the ceiling type of pain. So that they have a lot of pain, but you can't go in and find it until you aggravate or irritate that nerve. We have a percussion tool that we use to adjust these vertebrae in the early stages so that it's non-traumatic, and we can go in there and tap on those vertebrae, and if there's been rubbing on these nerves for a period of time, they are hypersensitive, like you would get from rubbing on your skin for an extended period of time, let's say weeks and days. You would obviously see the irritation of that situation, but you may not have any gross pain. You may even bleed before you start to have a whole lot of pain, and you can see that constant irritation is creating a problem, but it does not necessarily have to reflect itself as a lot of pain. So that pinched nerve is always precipitated by articular dysfunction, changes in the position of the vertebra in the spine that's putting a stress on the tissue. There are occasions, clearly, in which there are disc bulging that causes the pinched nerve. We understand that very clearly, tumors and what have you. But by far and large, these are the lowest percentage of problems that exist in our society. And furthermore, disc bulge is caused by the same phenomena. You can't have a disc bulge for no reason at all. There's got to be a changes in the load distribution, and it has to be over a period of time to precipitate a bulge disc or a herniated disc. So pinched nerves are actually changes in the position and function of the spine with adhesions and scar tissue that prevent proper mobility. Once these articulations are made to be mobile again by manipulation and various therapeutic procedures, and then with a very, very controlled rehabilitation protocol to rehabilitate the ligaments and the muscles around the paraspinal regions especially, you can go ahead and train this spine to go back into a pretty ideal situation. Certainly can continue to move toward ideal even as you age and degrade in life, and create the best function and the best scenario possible for dealing with what you got, even if you start late in life. So pinched nerves, we're going to go into part 2 about it, and we're going to talk a little bit about how it's expressed in the rest of the story about that person that came in that I started to talk to you about.